Hey, Alpha Nurses and Licensure from alphanursguide.com. This is 20 practice questions. Without the way, let's get started.
A client is to have a Schilling test. The nurse should 1. Administer methylcellulose. 2. Start a 24 to 48-hour urine specimen collection. 3. Maintain nothing by mouth status. 4. Start a 72-hour stool specimen collection. The correct answer is 2. Start a 24 to 48-hour urine specimen collection. Urinary vitamin B12 levels are measured after the ingestion of radioactive vitamin B12. A 24 to 48-hour urine specimen is collected after administration of an oral dose of radioactively tagged vitamin B12 and an injection of non-radioactive vitamin B12. In a healthy state of absorption, excess vitamin B12 is excreted in the urine. In a malabsorptive state, or when the intrinsic factor is missing, vitamin B12 is excreted in the feces. Methylcellulose is a bulk-forming agent. Laxatives interfere with the absorption of vitamin B12. The client is NPO 8 to 12 hours before the test, but is not NPO during the test. A stool collection is not a part of the Schilling test. If stool contaminates the urine collection, the results will be altered. A client has fatigue, temperature of 37.5 degrees Celsius, dark bronze skin, and dark urine. Hemoglobin is 9 grams per deciliter, hematocrit is 49, and red blood cells are 2.75 million per microliter. What should the nurse do first? 1. Initiate an intake and output record. 2. Place the client on bed rest. 3. Place the client on contact isolation. 4. Keep the client out of sunlight. The correct answer is 1. Initiate an intake and output record. The nurse should prepare to start an intake and output record because the client is exhibiting clinical manifestations of anemia with jaundice and is demonstrating a fluid imbalance. The client does not need to be on bed rest at this point. The client is not contagious and does not need to be placed in contact isolation. The changes in the color of the skin and urine are related to the jaundice and will not be affected by sunlight. Which position would most help to decrease a client's discomfort when the client's spouse injects vitamin B12 using the ventrogluteal site? 1. Lying on the side with legs extended. 2. Lying on the abdomen with toes pointed inward. 3. Leaning over the edge of a low table with hips flexed. 4. Standing upright with the feet one shoulder width apart. The correct answer is 2. Lying on the abdomen with toes pointed inward. To promote comfort when injecting at the ventrogluteal site, the position of choice is with the client lying on the abdomen with toes pointed inward. This positioning promotes muscle relaxation, which decreases the discomfort of making an injection into a tense muscle. Lying on the side with legs extended will not provide the greatest muscle relaxation. Leaning over the edge of a table with the hips flexed and standing upright with the feet apart will increase muscular tension. A client was admitted to the hospital with iron deficiency anemia and blood-streaked emesis. Which question is most appropriate for the nurse to ask in determining the extent of the client's activity and tolerance? 1. What daily activities were you able to do 6 months ago compared with the present? 2. How long have you had this problem? 3. Have you been able to keep up with all your usual activities? 4. Are you more tired now than you used to be? The correct answer is 1. What daily activities were you able to do 6 months ago compared with the present? It is difficult to determine activity and tolerance without objectively comparing activities from one time frame to another. Because iron deficiency anemia can occur gradually and individual endurance varies, the nurse can best assess the client's activity tolerance by asking the client to compare activities 6 months ago and at present. Asking a client how long a problem has existed is a very open-ended question that allows for too much subjectivity for any definition of the client's activity tolerance. Also, the client may not even identify that a problem exists. Asking the client whether he is staying abreast of usual activities addresses whether the tasks were completed, not the tolerance of the client while the tasks were being completed, or the resulting condition of the client after the tasks were completed. Asking the client if he is more tired now than usual does not address his activity tolerance. Tiredness is a subjective evaluation and again can be distorted by factors such as the gradual onset of the anemia or the endurance of the individual. A client had a resection of the terminal ileum 3 years ago. While obtaining a health history and physical assessment, the nurse finds that the client has weakness, shortness of breath, and a sore tongue. Which additional information from the client indicates a need for intervention and client teaching? 1. I have been drinking plenty of fluids. 2. I have been gargling with warm salt water for my sore tongue. 3. I have 3 to 4 loose stools per day. 4. I take a vitamin B12 tablet every day. The correct answer is 4. I take a vitamin B12 tablet every day. Vitamin B12 combines with intrinsic factor in the stomach and is then carried to the ileum, where it is absorbed into the bloodstream. In this situation, vitamin B12 cannot be absorbed regardless of the amount of oral intake of sources of vitamin B12, such as animal protein or vitamin B12 tablets. Vitamin B12 needs to be injected every month because the ileum has been surgically removed. Replacement of fluids and electrolytes is important when the client has continuous multiple loose stools on a daily basis. Warm salt water is used to soothe sore mucous membranes. Crohn's disease and a small bowel resection may cause several loose stools a day. Which of the following lab values should the nurse report to the healthcare provider when the client has anemia? 1. Schilling test result, elevated. 2. Intrinsic factor, absent. 3. Sedimentation rate, 16 millimeters per hour. 4. Red blood cells within normal range. The correct answer is 2. Intrinsic factor, absent. The defining characteristic of pernicious anemia, a megaloblastic anemia, is lack of the intrinsic factor, which results from atrophy of the stomach wall. Without the intrinsic factor, vitamin B12 cannot be absorbed in the small intestine, and folic acid needs vitamin B12 for deoxyribonucleic acid synthesis of RBCs. The gastric analysis is done to determine the primary cause of the anemia. An elevated excretion of the injected radioactive vitamin B12, which is protocol for the first and second stages of the Schilling test, indicates that the client has the intrinsic factor and can absorb vitamin B12 in the intestinal tract. A sedimentation rate of 16 millimeters per hour is normal for both men and women and is a non-specific test to detect the presence of inflammation. It is not specific to anemias. An RBC value within the normal range does not indicate an anemia. The nurse should instruct the client to eat which of the following foods to obtain the best supply of vitamin B12? 1. Whole grains. 2. Green leafy vegetables. 3. Meats and dairy products. 4. Broccoli and Brussels sprouts. The correct answer is 3. Meats and dairy products. Good sources of vitamin B12 include meats and dairy products. Whole grains are a good source of thiamine. Green leafy vegetables are good sources of niacin, folate, and carotenoids, which are precursors of vitamin A. Broccoli and Brussels sprouts are good sources of ascorbic acid, which is vitamin C. A client has been admitted with active rectal bleeding and has been typed and cross-matched for 2 units of packed red blood cells. Within 10 minutes of admission, the client faints when getting up to go to the bedside commode. The nurse notifies the healthcare provider, who prescribes a unit of blood to be administered immediately. The nurse can safely administer which type of blood for immediate transfusion? 1. A negative. 2. B negative. 3. AB negative. 4. O negative. The correct answer is 4. O negative. A routine serology study to confirm compatibility between a blood donor and recipient takes about 1 hour. In an emergency, O-negative RBCs can be safely administered to most clients, which is why a person with O-negative blood is called a universal donor. The other types of RBCs may cause an adverse reaction. A client had a mastectomy followed by chemotherapy 6 months ago. She reports that she is now unable to concentrate at her card game, and it seems harder and harder to finish her errands because of exhaustion. Based on this information, the nurse should suggest that the client do which of the following? 1. Take frequent naps. 2. Limit activities. 3. Increase fluid intake. 4. Avoid contact with others. The correct answer is 1. Take frequent naps. This client is likely experiencing fatigue and should increase her periods of rest. The fatigue may be caused by anemia from depletion of red blood cells due to the chemotherapy. Asking the client to limit her activities may cause the client to become withdrawn. The information given does not support limiting activity. Increasing fluid intake will not reduce the fatigue. The information does not indicate that the client is immunosuppressed and should avoid contact with others. The nurse is assisting with a bone marrow aspiration and biopsy. In which order, from first to last, should the nurse complete the following tasks? 1. Position the client in a side-lying position. 2. Clean the skin with an antiseptic solution. 3. Verify the client has signed an informed consent. 4. Apply ice to the biopsy site. The correct order is 3. Verify the client has signed an informed consent. 1. Position the client in a side-lying position. 2. Clean the skin with an antiseptic solution. And 4. Apply ice to the biopsy site. First, the nurse must verify that the client has voluntarily signed a consent form before the procedure begins, and check that the client understands the procedure. The nurse then positions the client in a side-lying or lateral decubitus, position with the affected side up. Then the nurse should clean the skin site and surrounding area with an antiseptic solution, such as betadine, before the healthcare provider numbs the site and collects the specimen. When the procedure is finished, the nurse must apply ice to the biopsy site to reduce pain. A client from a Mediterranean country is admitted with thalassemia, jaundice, splenomegaly, and hepatomegaly. Which of the following should be the primary focus of nursing care for this client? 1. Providing activities of daily living on the time schedule of the client's homeland. 2. Offering foods that the client enjoys in order to increase the intake of calories. 3. Decreasing cardiac demands by promoting rest. 4. Listening to concerns about the hospitalization. The correct answer is 3. Decreasing cardiac demands by promoting rest. This client has clinical manifestations of thalassemia major, a disease found in descendants from the Mediterranean Sea area whose mother and father both possess a gene for thalassemia. The severe hemolytic anemia causes sequestration of red blood cells in the spleen and liver, which leads to engorgement of the organs and chronic bone marrow hyperplasia. Rest will decrease the demands on the heart due to the diminished hemoglobin level, a physiologic concern. The nurse should follow the time schedule of the area in which the client is now living. The nurse can help the client prescribe preferred foods and listen to concerns, but the main priority is to decrease oxygen demands. When a client is receiving a cephalosporin, the nurse must monitor the client for which of the following? 1. Drug-induced hemolytic anemia. 2. Purpura. 3. Infectious emboli. 4. Ecchymosis. The correct answer is 1. Drug-induced hemolytic anemia. Drug-induced hemolytic anemia is acquired, antibody-mediated, RBC destruction precipitated by medications, such as cephalosporins, sulfa drugs, rifampin, methyldopa, procainamide, quinidine, and thiazide. Purpura is a condition with various manifestations characterized by hemorrhages into the skin, mucous membranes, internal organs, and other tissues. Infectious emboli are clumps of bacteria present in blood or lymph. Ecchymoses are skin discolorations due to extravasations of blood into the skin or mucous membranes. A client is admitted from the emergency department after falling down a flight of stairs at home. The client's vital signs are stable, and the history states that the client had a gastric stapling 2 years ago. The client jokes about being clumsy lately and tripping over things. The nurse should ask the client which of the following questions? Select all that apply. 1. Are you experiencing numbness in your extremities? 2. How much vitamin B12 are you getting? 3. Are you feeling depressed? 4. Do you feel safe at home? 5. Are you getting sufficient iron in your diet? The correct answers are 1. Are you experiencing numbness in your extremities? 2. How much vitamin B12 are you getting? 3. Are you feeling depressed? And 4. Do you feel safe at home? The nurse should ask the client about symptoms related to pernicious anemia because the client had the stomach stapled 2 years ago and shows no history of supplemental vitamin B12. Numbness and tingling relate to a loss of intrinsic factor from the gastric stapling. Intrinsic factor is necessary for absorption of vitamin B12. The nurse should suspect pernicious anemia if the client is not taking supplemental vitamin B12. Other signs and symptoms of pernicious anemia include cognitive problems and depression. The nurse also should ask about the client's support at home in case the fall was not an accident. Pernicious anemia is not related to dietary intake of iron. A physician prescribes vitamin B12 for a client with pernicious anemia. Which sites are appropriate for the nurse to administer vitamin B12? Select all that apply. 1. Median cutaneous. 2. Greater femur trochanter. 3. Acromion muscle. 4. Ventrogluteal. 5. Upper back. 6. Dorsogluteal. The correct answers are 4. Ventrogluteal and 6. Dorsogluteal. A client with pernicious anemia has lost the ability to absorb vitamin B12 either because of the lack of an acidic gastric environment or the lack of the intrinsic factor. Vitamin B12 must be administered by a deep intramuscular route. The ventrogluteal and dorsogluteal locations are the most acceptable sites for a deep intramuscular injection. The other sites are not acceptable. A client who follows a vegetarian diet was referred to a dietitian for nutritional counseling for anemia. Which client outcome indicates that the client does not understand nutritional counseling? The client: 1. Adds dried fruit to cereal and baked goods. 2. Cooks tomato-based foods in iron pots. 3. Drinks coffee or tea with meals. 4. Adds vitamin C to all meals. The correct answer is 3. Drinks coffee or tea with meals. Coffee and tea increase gastrointestinal motility and inhibit the absorption of non-heme iron. Clients are instructed to add dried fruits to dishes at every meal because dried fruits are a non-heme or non-animal iron source. Cooking in iron cookware, especially acid-based foods such as tomatoes, adds iron to the diet. Clients are instructed to add a rich supply of vitamin C to every meal because the absorption of iron is increased when food with vitamin C or ascorbic acid is consumed. The nurse devises a teaching plan for the client with aplastic anemia. Which of the following is the most important concept to teach for health promotion and maintenance? 1. Eat animal protein and dark green, leafy vegetables every day. 2. Avoid exposure to others with acute infections. 3. Practice yoga and meditation to decrease stress and anxiety. 4. Get 8 hours of sleep at night and take naps during the day. The correct answer is 2. Avoid exposure to others with acute infections. Clients with aplastic anemia are severely immunocompromised and at risk for infection and possible death related to bone marrow suppression and pancytopenia. Strict aseptic technique and reverse isolation are important measures to prevent infection. Although diet, reduced stress, and rest are valued in supporting health, the potentially fatal consequence of an acute infection places it as a priority for teaching the client about health maintenance. Animal meat and dark green leafy vegetables, good sources of vitamin B12 and folic acid, should be included in the daily diet. Yoga and meditation are good complementary therapies to reduce stress. 8 hours of rest and naps are good for spacing and pacing activity and rest. The nurse has just admitted a 35-year-old female client who has a serum vitamin B12 concentration of 800 picograms per milliliter. Which of the following laboratory findings should alert the nurse to focus the health history to obtain specific information about drug or alcohol use? 1. Total bilirubin, 0.3 milligrams per deciliter. 2. Serum creatinine, 0.5 milligrams per deciliter. 3. Hemoglobin, 16 grams per deciliter. 4. Folate, 1.5 nanograms per milliliter. The correct answer is 4. Folate, 1.5 nanograms per milliliter. Normal range of folic acid is 1.8 to 9 nanograms per milliliter, and normal range of vitamin B12 is 200 to 900 picograms per milliliter. A low folic acid level in the presence of a normal vitamin B12 level is indicative of a primary folic acid deficiency anemia. Factors that affect the absorption of folic acid are drugs such as methotrexate, oral contraceptives, anti-seizure drugs, and alcohol. The total bilirubin, serum creatinine, and hemoglobin values are within normal limits. The nurse is preparing to teach a client with microcytic hypochromic anemia about the diet to follow after discharge. Which of the following foods should be included in the diet? 1. Eggs. 2. Lettuce. 3. Citrus fruits. 4. Cheese. The correct answer is 1. Eggs. One of the microcytic hypochromic anemias is iron deficiency anemia. A rich source of iron is needed in the diet, and eggs are high in iron. Other foods high in iron include organ and muscle meats, shellfish, shrimp, and tuna, enriched, whole grain, and fortified cereals and breads, legumes, nuts, dried fruits and beans, oatmeal, and sweet potatoes. Dark green, leafy vegetables and citrus fruits are good sources of vitamin C. Cheese is a good source of calcium. A client is to have a transfusion of packed red blood cells from a designated donor. The client asks if any diseases can be transmitted by this donor. The nurse should inform the client that which of the following diseases can be transmitted by a designated donor. Select all that apply. 1. Epstein-Barr virus. 2. Human immunodeficiency virus. 3. Cytomegalovirus. 4. Hepatitis A. 5. Malaria. The correct answers are 1. Epstein-Barr virus, 2. Human immunodeficiency virus, and 3. Cytomegalovirus. Using designated donors does not decrease the risk of contracting infectious diseases, such as the Epstein-Barr virus, HIV, or CMV. Hepatitis A is transmitted by the oral fecal route, not the blood route. However, hepatitis B and C can be contracted from a designated donor. Malaria is transmitted by mosquitoes. A client with iron deficiency anemia is refusing to take the prescribed oral iron medication because the medication is causing nausea. The nurse should do which of the following? Select all that apply. 1. Suggest that the client use ginger when taking the medication. 2. Ask the client what is causing the nausea. 3. Tell the client to use stool softeners to minimize constipation. 4. Offer to administer the medication by an intramuscular injection. 5. Suggest that the client take the iron with orange juice. The correct answers are 1. Suggest that the client use ginger when taking the medication. 2. Ask the client what is causing the nausea. And 5. Suggest that the client take the iron with orange juice. Nausea and vomiting are common adverse effects of oral iron preparations. The nurse should first ask the client why the client does not want to take the oral medication, and then suggest ways to decrease the nausea and vomiting. Ginger may help minimize the nausea, and the client can try this remedy and evaluate its effectiveness. Iron should be taken on an empty stomach, but can be taken with orange juice. The client can evaluate if this helps the nausea. Stool softeners should not be used in clients with iron deficiency anemia. Instead, constipation can be prevented by following a high-fiber diet. Administering iron intramuscularly is done only if other approaches are not effective.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.